This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar. This seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is how to practice mindful eating. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted once the presentation concludes, and your questions will remain anonymous. Today's presenter is Michelle Merdolo. Michelle is our registered dietitian nutritionist, currently working to guide patients through their bariatric surgery and weight management journey. She comes from a background of disordered eating and eating disorders, and emphasizes body positivity and health at every size principles. Michelle, you can go ahead and get us started.
Hi, everyone. Thanks for joining today for the webinar on mindful eating. Again, my name is Michelle. I'm a registered dietitian here at Mather. We'll just be going through a little bit of information on mindful eating today. So to start, of course, what is mindfulness? Well, mindfulness basically is paying attention to something or an experience in the present moment without judgment. So when we talk about an experience, that could be a thought, it could be a repetitive thought. It could also be things like emotions, sensations, just things out in the world. So examples of that could be what your meal looks like, what it tastes like, what it smells like. It could be negative or positive thoughts about your food or your food choices. When we say without judgment, that's a really important piece there. We often think about or judge our food choices, our eating experiences, how we feel about the food that we have. So it's really important to take that judgment away when you're focusing on mindfulness. So really, mindfulness is non-judgmental awareness. We want to stay present in the moment with our experiences as they shift and as they change. And there's no such thing as getting it perfect. We want to think about accepting things even if they are not pleasant or even if we don't like them. It's an active process. It requires us to hold our attention, and the focus is always on the process, not on the outcome. So we're not looking for a specific outcome. We want to let go of any expectations we have. We always want to focus on the experience and just allow whatever outcome to come. This requires an open mind, and we want to be aware of or acknowledge that, again, things may not be perfect. So this may not be the most perfect meal ever, but that's okay. So what mindfulness is not? It's not forcing the outcome. So again, remember, we're letting go of control. We're letting go of expectations. We're just allowing whatever may happen to happen. We're not controlling our situation. We're just allowing it to happen. We're not finding certainty because we're remembering our experiences, our situations, they're always shifting, they're always changing. Again, it's not about perfection and it's not about judgment. We're just acknowledging and noticing what's happening. And mindfulness can change our brain. So we want to think about the concept of neuroplasticity, so the ability of the brain to change itself. So mindfulness can change the brain structure and even the brain function. It helps to improve self-regulation, mood, concentration, sleep, memory, and more. Mindfulness of even just 5 minutes per day is recommended, and it can be either formal or informal. So when we say formal, that could be something like a meditation, whether it's something you plan out yourself or sitting down doing a recorded or a group meditation. It could also be informal, so that would just be any time of the day, however you choose to do your mindfulness. Now, when something is repeated over and over in the same way, the pathway gets stronger. So mindfulness creates alternative pathways in the brain or new ways of acting or thinking. This can also occur with negative pathways, so negative self-talk, over-exercise, restriction. So things like also talking about or treating your body badly. So when we focus on mindfulness, this helps to reduce helps to reduce negative pathways in the brain so that we can now create new, more positive ones. Mindfulness can rewire the brain so we don't automatically respond with anxiety, with disordered behavior, whether it's disordered thinking or disordered eating. So we want to think about less anger, more compassion, less fear, more kindness. When we have an experience, again, we act in a repetitive way. We have an automatic response. With mindfulness, we're not changing this experience. Remember, we're just acknowledging our experience, but we're developing skills that help us notice the experience, consider our options, and now we can skillfully respond to our experience. So how can we incorporate mindfulness into eating? So remember, mindfulness is the act of full attention, paying full attention non-judgmentally to our moment-to-moment experiences. So we are deliberately paying this attention. We're fully aware of what's happening inside of ourselves and outside of ourselves. So in our environment, we're aware without judging, without criticizing. So some principles of mindful eating: we allow ourselves to become aware of the positive and nurturing opportunities that are available through our food selection and preparation by respecting our own inner wisdom. And we use all of our senses in choosing to eat food that is both satisfying to you and nourishing your body. So that could mean something satisfying to you, having a piece of chocolate, something nourishing to you, having broccoli. Both of those things fit within mindful eating. We take away any moral place or moral placements on food. Nothing is better or worse morally. All foods can fit into our diet. We acknowledge responses to food, so whether we like something, whether we don't like it, whether we just feel neutral about food, and we take away the judgment from that. And we become aware of our physical hunger and our physical satiety cues, and we use that to guide our decisions to begin and end eating. Now, someone who eats mindfully, they acknowledge that there's no wrong or right way to eat, but there's varying degrees of awareness surrounding the experience of food. We accept that our eating experiences are unique. Everyone has different experiences around food and around eating. Someone who eats mindfully is an individual who, by choice, directs their attention to eating on a moment-by-moment basis. You gain awareness of how you can make choices that support your health and your well-being. Part of this is also your mental and emotional well-being. So again, that can also include choosing foods, choosing things that you like, that you enjoy. And you become aware of the interconnection of Earth, of living beings, and cultural practices, and the impact of the food choices on those systems. So mindful eating is self-directed. You control this. You direct your own mindful eating experience. You, again, know every person's experience is different, is unique. And you may want to ask yourself while practicing this, am I hungry? What part of me is hungry? What do I crave? And what am I tasting right now? How am I experiencing this food? A lot of research even suggests that mindful eating may be able to naturally regulate our weight. So this is not the same as dieting or going on a diet, but it's occurring more naturally as we experience this. So one study that was done in 2017 examined a program called Eat Smart, Move More, Weigh Less. This program focused on increasing mindful eating, and it looked at the relationship between mindful eating and weight loss. So the intervention group found a statistically significant increase in mindfulness scores, plus there was also a mean weight loss of 1.9 kilograms compared to just 0.3 kilograms in the control group. So there were 80 participants, 28 completed the program, 36 were the control group. Looking at pounds compared to kilograms, it was about 4 pounds lost compared to just a half a pound lost. And the researchers said that the results suggest there is a beneficial association between mindful eating and weight loss. Now, another study done just recently, 2021, called the EAT study, found that an 8-week mindful eating program led to increases in mindfulness and self-compassion scores, along with decreases in overeating symptoms, oral control, and anxiety. Then there's the MBEAT, which this has actually been used in a lot of different studies. So that stands for the Mindfulness-Based Eating Awareness Training. This is a program developed by Jean Christeller. It combines mindful eating, meditation, and a discussion on how mindful awareness can help with understanding behaviors and experiences when it comes to food. So a lot of different studies have used this, different kinds of studies. A few were done on binge eating disorder. So one study examining binge eating disorder and mindfulness found that the number of binge eating episodes among participants decreased from more than 4 per week to about 1.5 per week. Many participants at the end of the study no longer even met the criteria for binge eating disorder. Another study done, again using the MBEAT, found that participants also in the study experienced reductions in binge eating episodes, and they also had improvements in depression. Now, a third study that also looked at binge eating disorder also examined weight loss. This one found that participants with binge eating disorder lost about 7 pounds after 10 sessions with mindfulness and using the MBEAT program. Now, this program was also used examining diabetes. It was adjusted a little bit. It was just the MBEAT-D, so just for diabetes. Now, this one combined mindful self-awareness around food. It also used nutrition and diabetes education. So during each session, there was one group of participants that practiced mindful eating exercises. They focused on using their medication, and then they were also educated about nutrition and diabetes. And there was another group that had no mindfulness education. They just had intensive counseling on diabetes, on calories, on exercise. So they found that both groups had significant weight loss. They had improved glycemic control, increased fiber intake, lower trans fat, and sugar consumption. There were no significant differences in weight or glycemic control between the two groups. So this suggested that a mindful eating-based technique can complement or even provide a different alternative for diabetes patients. And then one final study that also examined the MBEAT, it looked at targeting stress eating and cortisol levels. So obese patients experienced significantly lower cortisol levels and decreased anxiety using this program. They had no changes in weight from baseline. However, control subjects had a gain in weight during the study, so subjects that did not use any mindfulness techniques. Patients who reported the greatest reduction in stress also had the largest decreases in abdominal fat, and these patients used the mindfulness techniques. So what's the difference between mindful eating and dieting? I mentioned before that mindfulness or mindful eating is not the same as a diet, but how do they differ? So with mindful eating, you're choosing food that you enjoy, or you're choosing food based on what you enjoy or what you want, maybe how it makes your body feel. As opposed to dieting, you're just choosing foods based on what your diet allows, what it tells you you can have. With mindful eating, you're listening to your body's internal cues of hunger and fullness using something called the hunger scale, which I have a slide on in a little bit. With dieting, you're just eating, again, based on what your diet tells you. So when or what time your diet says you can eat, regardless of hunger, regardless of fullness. With mindfulness, you enjoy your food while you're eating it. You acknowledge all aspects, the taste, the smell, the experience, the appearance of it. With dieting, you may not pay attention to the aspects of your food, especially if it's not even enjoyable. With mindfulness, we reflect without judgment on our food or our meals. We may say this wasn't the most enjoyable meal ever, but again, every meal doesn't have to be perfect, so that's okay, and we're able to move on. However, when we're dieting, we may look back on food or meals that were not enjoyable, and we feel guilt, we feel judgment. We wonder why we even allowed ourselves to have something that we didn't even like. With mindfulness, we're aware that hunger levels aren't static and they can vary day to day. However, when we're dieting, we feel concerned as if we did something wrong when our hunger fluctuates, even though this is a normal part of life and how our bodies work. And with mindfulness, we understand that we may overeat sometimes, we may undereat sometimes, and we know this is okay, and this is a normal part of life. But when we're dieting, if we under or overeat, this can be due to strict calorie limits we set. We often feel guilty, and we struggle to stick to these calorie limits. A lot of research finds that with dieting, no matter what diet we're on, no matter what food we have or what food we don't let ourselves have, a lot of dieters lose an average of about 8 to 11 pounds, and they gain that back within a year or less, and typically gain more back as well. And it's really important to note that hunger is not a bad thing. A lot of what we hear in society today, a lot of what dieting tells us is that hunger is bad. We shouldn't feel hungry. We should ignore our hunger, avoid it. But hunger is not bad. When we're eating mindlessly, we may ignore our hunger. We may skip our meals. Again, we may try to push away that hunger. A lot of the times we're cutting out foods, we're cutting out food groups in an attempt to lose weight, and doing this actually throws off our hunger cues. We kind of lose the ability to understand, to listen to these hunger and fullness cues, and it kind of throws our body out of whack. This also doesn't really work very long term, because eventually that hunger is going to become too extreme, and often it leads to overeating, and then that guilt comes. We feel guilty for eating too much. We feel like we didn't have the self-control to avoid it, even though it's really our diet that failed us. We get back into that cycle again. We start the diet again. We restrict. We eventually overeat. Here comes the guilt, and it just repeats. Mindless eating can also involve grazing all day and never really allowing your body to become fully hungry or to become fully satisfied. We're eating small amounts just to kind of push away that little hunger, but we're never really full, so we're immediately becoming hungry again. Hunger is important though, because this is how we naturally regulate our intake, by eating when we feel hungry and stopping when we feel full. So we were all born natural, intuitive eaters, or being able to know when to eat, know when to stop. But when we ignore this hunger, we're throwing that off. So how do we embrace our hunger? Well, we can allow time in between meals for our hunger to develop. We can come to the table hungry, allow ourselves to become comfortably full. You may want to notice how hunger allows you to enjoy your food more. We can acknowledge all the things that our body can do when it's nourished. Hunger tells you more nutrition is needed. And we want to become acquainted with the hunger scale, and that's what we're going to talk about on the next slide. So this is one example of our hunger and fullness scales. There are a lot of different versions that exist in the world. But basically the hunger fullness scale is a scale that goes from 1 to 10. 1 is basically you're starving, you're ravenous, you're so hungry. 10 is painfully full, uncomfortable, you may need to lay down, you need to rest, you need to relax because you're in physical pain from eating too much. And the hunger scale is a way for us to mindfully assess our hunger. It helps us become more in tune with, or it helps us understand our hunger. It can be helpful to mentally rate or mentally assess our hunger before and after meals. Sometimes even, whether again before or after, pairing maybe how we're with that hunger. This can help us understand if our emotions affect how we're feeling before or after our meals. So the goal is to start eating when we're hungry and to stop when we're full. So with that goal in mind, we want to stay between a 3 and a 7. So when we get to that 3, the stomach growling, we're hungry, we have some hunger pangs. That's when we want to start eating our meal. We eat slowly, chew our food well, enjoy our food, eat it mindfully. We stop when we're at a 7, we're pleasantly full, we're comfortable, but not uncomfortable. So again, this scale teaches us how to stay between hungry and satisfied. It helps us begin to honor our body's need for fuel and learn how to give it the right amount. So using mindfulness skills, we can practice observing how we're feeling in our bodies before and after our meals without judging those feelings, and learn when it's time to start eating, when it's time to stop eating. And mindful eating can even help with body image. So mindful eating, again, helps us become more aware. This can help us identify triggers for negative body image and build up skills to use in the moment. It teaches us not to focus on control or perfection or manipulation. This can help us be more aware of our negative thoughts rather than acting on them. So it reduces our need to fix, control, change our bodies as a reaction to a trigger, and it helps us develop more self-compassion, more self-care, and more self-respect. And these are just some guidelines for mindful eating. These come from a book called Mindful Eating, written by Jan Chosen Bays. So our first guideline for mindful eating is slow it down. Now, when we say that, kind of exactly what it sounds like. We want to eat more slowly. So we live in a society right now where the goal is often to eat your meal as quickly as possible, to get it over as soon as possible. However, research suggests that in America, we spend about 11 minutes eating lunch at a fast food restaurant, about 18 minutes at the workplace cafeteria. But meals should be a time to enjoy our food, to enjoy the company that we're eating our food with, to enjoy how our food feels for our body, how it tastes. When we eat slowly, we get to notice and enjoy the texture of our foods. We get to enjoy the flavor of our food. We also can ease any digestive discomfort that may occur if we're eating too quickly. When we're eating quickly, we're not allowing ourselves time to listen to our body cues. We're not allowing our stomach to signal us that we're full. We're more likely to overeat. So if you notice that you're not tasting your food as you're eating, just slow it down. Try to chew your food a little more thoroughly, noting how each bite tastes, how it feels, how you're enjoying the food, or maybe even not enjoying the food. You may want to try putting your fork down in between bites so you can enjoy the taste more, and that'll help you slow the meal down. So our next guideline for mindful eating is eating the right amount. So the right amount would be defined as the appropriate amount, the beneficial amount, the amount that leads to happiness. This is not a fixed amount, so we can determine, or we need to be mindful to determine this amount. Often as children, we're taught to clean our plate, but this isn't always necessary. Especially now with increased portions and increased serving sizes, a lot of research now suggests that if we're presented with a larger portion, we tend to eat more regardless of our hunger or fullness cues. So it's more helpful to just portion the right amount or the appropriate amount for us rather than overplating. Now, up until age 5, children are typically able to regulate or more easily regulate their internal body cues regardless of portion. But over time, after age 5, we slowly start to lose this ability and portion begins to play a bigger role. Physiological satiety cues are often overridden by food cues, things like portions, access to food, appearance, even taste of food. We often ignore our body cues for so long that over time we lose the ability to determine when to stop eating. In Japan, there's a group of people called the Okinawans. They're actually the longest lived people in the world, or the people that live to the oldest age. They follow something called Hara no Hachibu. That's what they define as eating until 2/3 full. So rather than overeating, rather than getting to that point of uncomfortably full, they eat until they're satisfied, until they're about 2/3 full. They avoid any pain, any discomfort after their meals. Now, our next guideline for mindful eating is what we call the energy equation. So we want to keep in mind that, yes, food is something, of course, to enjoy and to be enjoyed. It also provides us energy, though. It helps us maintain a balance, and we want to maintain that balance in the body. So if we're maintaining our weight, of course, within a range, we're never going to maintain at the exact same number, but within a range, we're in balance. If we're gaining, we're taking in more energy than we're expending, and if we're losing, we're expending more than we're taking in. So what we take in is our food. What goes out? Multiple factors. Just our activities of daily living, things like moving around. If it's cold weather, keeping ourselves warm, and just the daily metabolism that occurs in all of our cells. This also explains the normal fluctuations of hunger. Could be things like, again, keeping warm if it's cold weather. We may be fighting a cold or an infection. We may have been more active one day as opposed to the other. All of those things could explain feeling more hungry, or maybe we didn't move a lot, the previous day, so now we're not feeling as hungry. So these are all different reasons why we may be feeling more or less hungry. Of course, there are tons of other reasons to feel more hungry, to feel less hungry. Our society provides large portions and little room for activity, so weight gain is common currently. Once we gain weight, it is hard to lose because the body has certain mechanisms that kick in to protect itself. So, for example, when you go on a fad diet, you lose weight rapidly, the body can go into kind of like a starvation mode, and then it can't tell the difference between whether you were on a diet or whether you were in a famine. Because of this, the body wants to protect itself from any extra weight loss, and it wants to hold on to everything you have. So now the next time you're eating, it's going to hold on to everything you take in. It's going to do everything it can to cause you to gain the weight back and to hold on to that weight once you gain it back, because it wants to have that extra store for the next time you may experience a famine. It wants to be able to protect itself. So those are typically the reasons why diets don't work, why it's hard to lose weight, why it's hard to maintain weight. The body is just trying to protect itself in the case of a famine. Now, our next guideline for mindful eating is called mindful substitution. So many of us tend to have these different negative thoughts or negative voices in our head that may criticize us, they may put us down. So how do we kind of fight these or combat these? So the first thing, the easiest thing to do is just becoming aware of these voices and noticing these thoughts, noticing when they come up, what these thoughts are, what they're saying. A lot of the time, these thoughts that we're having may conflict. So one thought may be, I want an ice cream sundae. The other thought may be putting ourselves down for wanting to indulge. With mindful substitution, we may compromise or meet the voices in the middle. Say, having a piece of chocolate, having an ice pop, eating it mindfully, things like that. Keep in mind, this does not mean that every time you have a craving for an ice cream sundae that you just push that craving away and don't have it. If you are truly craving this item, it's okay to have it. What you really want to do is think about, is this truly what I want? Am I truly having a craving for it? How am I feeling in this moment? What do I want? Giving into both sides of these thoughts, we need some more, again, compromise, see what we're really feeling, see what we're really thinking. Remember, all foods fit. We don't want to be only having the broccoli, only having the ice cream. Now, our next guideline for mindful eating is out of sight, out of mind. Research shows that secretaries with chocolates on a glass dish on their desk ate more candy than if it was hidden in a drawer, even less if they had to get up and walk to it. So people are more likely to eat more if the serving tray of food is left on the table than if they had to get up and go over to it. When something is not within our sight, we're less likely to crave it. This works because these thoughts lose strength without reinforcement. So again, this does not mean that you are not allowed to have the foods you enjoy, but again, thinking about being more aware of it. Am I truly craving this? Am I truly in the mood for it? Or is it just because it's sitting right in front of me? And then our last mindful eating guideline is loving kindness and the inner critic. So it's, again, very easy to develop these many negative thoughts, many negative emotions when we're struggling with our relationship with food. We may start feeling badly when seeing our own body in the mirror. We may want to avoid seeing it altogether when these thoughts come out and start getting really strong. We may feel jealous of others who are eating things we want to be eating. We may feel angry that we continue to struggle with food and feel like others may not be struggling. So when our mind is full of conflicting thoughts and conflicting emotions, it's really difficult to determine how to respond. Mindfulness, again, can help us settle these thoughts, can help us figure out how to respond. It can create a space to acknowledge all of the all the different thoughts we're having at once. So there's a few different thoughts that have been noted that kind of come up at once when we're struggling with mindfulness. So one thought may be, or one voice we may hear may be the inner perfectionist. We may look at what we feel are our imperfections, and this voice, this thought may tell us what we want to aim for. So things that we think are our imperfections or things that we should be striving for may be compassion, intelligence, improving our appearance. And the inner perfectionist may look at, say, like Photoshop social media images, Photoshop posts and say, this is perfection, this is what I want, this is what I want to aim for. The inner perfectionist doesn't care that this is not realistic or what cost this perfection comes at. And there's also the inner pusher. It tells us what we need to do in order to achieve this perfection. So the inner pusher is never satisfied. Whatever we achieve, you'll likely feel it's not good enough and you need to do more. So for example, if you're striving for weight loss, you lose 5 pounds, oh, yay, that's great. But the inner pusher says 5 pounds isn't good enough, where's 5 more? So again, the inner pusher is never satisfied. It may be focusing on weight. It could also be looking for the latest, fad diet. It's always pushing for more, for more, for more. Then you have the inner critic. It's always going to attack. It's always going to criticize. It's also never satisfied. It has a lot to say, maybe about food. You should be doing this. You should not be doing that. You should eat this. You shouldn't eat that. This food is bad, this food is good. It tends to work on comparison. So when we're mindful and only in the present moment, there's nothing to compare and the inner critic fades. There's also the perfectionist, may, obsess over diets until it picks the perfect one. The pusher is gonna, implement the diets, tells you what you can do, what you cannot do, where to eat, to shop, and then the critic is going to point out all your struggles, tell you how these diets haven't worked in the past. So in small doses, these voices can be helpful. They may find us role models, they may motivate us, and some criticism can be constructive, but when they get too much power, they can become destructive. So part of mindfulness is to acknowledge all these different voices, but not get caught up in them. Practicing informal or formal mindfulness, so meditations, or again just sitting down for 5 minutes and practicing mindfulness however works for you, can be helpful. One type of mindfulness you can practice is loving kindness. So it's kind of exactly what it sounds like, being more self-compassionate, focusing on directing love and kindness towards yourself. And there are guided loving kindness meditations that you can look up, and you can sit down, listen to the meditation, and do them yourself. This can be helpful when working with negative self-thoughts, again, such as the inner perfectionist, the inner pusher, the inner critic. And now just to kind of finish off, what about intuitive eating? This has kind of become something very popular that we probably hear a lot about lately. And sometimes we hear the terms intuitive eating and mindfulness interchangeably. So what is intuitive eating? Well, the focus again of mindful eating is more non-judgmental awareness, but intuitive eating is a little different. And the main focus of this is honoring your body's internal hunger and fullness cues. So again, similar to mindfulness, but slightly different. Now, as an infant, we naturally have these hunger cues and we naturally listen to them. So again, up until like age 5, we're more intuitive eaters. We know how to listen to what our body tells us. Intuitive eating helps us to balance honoring our health with our food choices. It also helps us learn to be kind to ourselves if we overeat, if we eat indulgent foods. There are about 10 principles on intuitive eating, so it can be a little bit more specific, and they all come back, though, to this main focus of honoring your hunger and fullness, of honoring your body. Certain other principles for intuitive eating could be rejecting the diet mentality, looking at all foods as morally equal, rejecting the food police, things like that. One of our other dietitians, also in the same department, actually, her name is Erin. She will be presenting on this a little bit later in the year, so I'm not going to get too much into intuitive eating, but if you are interested in it, definitely, come back for her presentation when she speaks about it. But mindful eating and intuitive eating are definitely the perfect combination. They work together, they complement each other. When you use both strategies together, you can definitely find peace in all aspects of eating. And just a little quote from actually, again, the book Mindful Eating. So this is from the introduction to the book. It was written by Jan Kabat-Zinn. She just said, if we are always on the way to someplace else, to some better now, when we will be thinner or happier or more accomplished or whatever it is, then we can never be in a wise relationship with this moment and love ourselves the way we actually are. These are just the references, sources for this presentation. And then on the next slide, I do have just a TED Talk that I recommend that, again, talks about mindful eating and making peace with food.
Thank you so much, Michelle. That presentation was fantastic. If anybody has any questions, please feel free to enter them in the Q&A spot. We'll wait a minute or so for those to pop through. All right, well, we'll start wrapping up in the meantime. Michelle, thank you for your time today. You guys will be getting an email with the recording to this webinar, so in case you'd like to view it again or refer to a friend. Michelle, are people able to make an appointment with you or the bariatrics department, like to talk more about, mindful eating or anything else that you guys offer? Do you want to talk about that a little bit?
Yes, yep. They can make an appointment with me. They can make an appointment with any other of the dietitians.
We have a question. What do you think of intermittent fasting?
I personally am not a huge fan of intermittent fasting. I mean, we already naturally fast overnight. The whole reason or the purpose of breakfast is to break that fast. So, I mean, some people really enjoy intermittent fasting. If it works for you, that's great. But I find it's more helpful to eat consistently throughout the day. Helps keep, your metabolism working regularly instead of having spikes and dips in your blood sugar. A lot of the time we find that if you're going long periods of time without eating, you can get very, very hungry, start to feel, again, that famished feeling, and that can lead to overeating, and you're not actually changing or reducing the calories you're taking in, because, again, you get that large increase in hunger, and it just leads to overeating in the end. So personally, I am not a fan of intermittent fasting.
Somebody asked if they could get a copy of the slides. That's something I can talk to Michelle about. I don't know if you'd be okay with sending out a copy of the slides or if you keep them internally only.
Oh yeah, that's fine with me. Yeah.
Okay, sure. So you guys will get an email to complete a survey on how Michelle did and how the webinar experience was, and you'll get a copy of the slides to go with that as well. We got a bunch of thank yous, and you made this very easy to understand. So thank you, Michelle. And what do you think?
Thank you.
What do you think of Noom?
So that's pretty much a diet, just in an app version. It's pretty similar to like Weight Watchers and all those things. They aren't, as far as I know, they don't have any, registered dietitians or anything like that on the app. It's more, I believe they call them health coaches or something like that. So it's not really anyone like certified. Again, no one who has like the full educational background. So again, not something that I'm really a fan of. It's just another diet.
Okay, great. If you guys are interested in making an appointment, I could also put the phone number. If you'd like to speak to one of the dietitians here, you'll get a link to the survey, and you will also get a version of the slides from today. Michelle, thank you again for your time, and everybody, please enjoy the rest of your day.
Thank you.